Welcome to the pharmacology class, and today's topic is principles of the antibiotic therapy. And antibiotic therapy is a quite complicated thing because the drugs that used for antibiotic therapy are designed the way that they are selectively toxic for the bacteria but are more or less non-harmful for the host, so for the human cells. But this selective toxicity is not uh, universal, so sometimes, especially when the dose is high, uh, the antibiotic will be uh, toxic for the human cells as well. And usually this toxicity will limit the duration of administration as well as the maximum therapeutic dose of the antibiotic. Besides that, the antibiotics are different from all other drugs we studied before because they have additional characteristics that you should take into account when selecting the right drug for the antimicrobial therapy. And one of the most important of these characteristics is antibiotic spectra, and we will talk about that a little bit later. And the uh, there are two types of the antibiotics that are available. One's, one's are one one part is bacteriostatic and another is bactericidal. So bacteriostatic drugs will decrease will not decrease the number of the viable bacteria, but will prevent the growth and replication of bacteria, so the number of the bacteria will stay low and the immune system of the host organism can decrease the amount of the bacteria further because there is not so many of them left, and these are bacteriostatic agents. And second type is bactericidal, and bactericidal antibiotics will uh, decrease the amount of the bacteria by killing the bacteria. However, they don't prevent the growth of bacteria, and that is why uh, the immune system still requires to prevent the to clear the bacteria completely, but uh, the effectiveness of the antibiotic will not depend on the type of bacteriostatic or bactericidal. They both are equally effective. However, one should not combine two types of the antibiotics, like one is bactericidal and another is bacteriostatic, because usually the bactericidal antibiotics will inhibit the cycle of the cell division, and that will decrease the efficiency of the bacteriostatic agents. And here on the graph we also see the increase in the number of the bacteria without treatment, and that is very fast increase because bacteria divide very fast, like some Escherichia coli rods will divide like every 2 seconds. So the number of bacteria will increase uh, twice every second, almost every second. So it's increase in geometrical progression. And there are a lot of things that one should uh, take into account when starting an antibiotic therapy, because some of the antibiotics are very expensive. So this is the cost of the treatment of the uh, Staphylococcus aureus staph assay with the different antibiotics. So depending on the selection of the antibiotic, the cost of that treatment will be different, but the efficiency is the same. So like cefazolin is the most cheapest drug available, and is readily available almost in every pharmacy. Then vancomycin is usually used only in the hospital, and is reserved for the resistant microorganisms, and that is why its cost is a little bit higher. And clindamycin is very effective, one of the most effective antibiotics that, and is also very expensive. So this one is also available everywhere, but is very expensive. And then
Hello.
linezolid is a new antibiotic that is not available, as well as daptomycin, and both of these antibiotics are very expensive. So never use them for the treatment of Staphylococcus aureus, because there are uh, cheaper antibiotics available, and these antibiotics are as effective as this one, but the cost of the treatment is uh, much lower. So besides the cost of the treatment, there are many things to consider about the antibiotics, and the uh, there are so many things to consider. So first of the uh, the first is the dosage. So the dose is very important for the antibiotic treatment, because depending on the disease, it can vary dependent on the disease, because some diseases will require lower doses or loading doses, and then others will require higher doses and longer treatment. And failure in prescribing the right dose can make the treatment completely ineffective. So because uh, antibiotics will be only uh, lead to the cure when used in a desired dose. And also the sometimes the dose should be calculated when the treatment is uh, when the treatment is dose dependent, and when but usually that's only required uh, for the HIV and very complicated uh, infections. For the most infections, the doses are only different for the children. So, and in adults, usually dose for adolescents, for the teenagers and uh, adolescents, the doses are the same. So the second is the timing to start the treatment is also very important, and the rule of the thumb is the uh, earlier the treatment is started, the more is it will be effective, because the microorganisms will grow continuously, and the earlier the treatment will start, the easier will be uh, the resolution will be faster, and then the treatment will be shorter. But sometimes the duration of treatment will not depend uh, on the timing of the start of the treatment. So, but the earlier we start the treatment, the lower are the complications from the disease, and also the uh, the less toxicity from the microorganisms that are killed with the antibiotic. Also, uh, the first doses of the antibiotic can be increased to achieve the plasma concentration of the drug faster. That is important, especially when it is important to start the treatment as fast as possible in case of the uh, dangerous infection, or when infection is in the central nervous system and will lead to the meningitis. The way of administration is also very important. Most of the antibiotics will be administered by mouth in the form of the tablets or capsules, but the uh, injections are also available uh, some uh, for some uh, serious infections. So usually the intramuscular way is used to introduce the antibiotic, and sometimes when antibiotic will not cross the blood-brain barrier, the intrathecal way can be also be used, but usually the central nervous system infection is treated with the antibiotic that will readily cross the blood-brain barrier. And also the solubility of the drug is important for drugs that are um, water soluble, will not pass to all body fluids, and that is why the treatment can be less effective. For example, for some infections that will reside in the urine, in the urinary tract, or in some compartments of the body that are less permeable for the drugs. For example, some viruses can be kept in the prostate fluid, because most of the drugs will not pass to the prostate fluid and then can lead to reinfection, like for example Zika virus. And uh, antibiotics are only effective against the bacteria, not against the viruses, except some antibiotics that have an antiviral activity. But this is very, it's an exception. So most of the time antibiotics are only used for the bacterial infection, and before prescribing the antibiotic, or the physician should make sure that the infection is uh, caused by the bacterial flora rather than the uh, viral or uh, fungi or any other any other reason. So Also, when the tests are available for the uh, antimicrobial activity, so the tests for the susceptibility of the bacteria are available, one can order them to select the most effective antibiotic, but most of the time the treatment is empirical, so uh, the, uh, the selection of the drug is made by the umbrella principle. When you prescribe the uh, so when you dispense actually when you dispense the uh, antibiotic that is that has a broad spectrum, so will cover the all the microorganisms that can cause this disease, particular disease. So most of the time the tests are not, there is no time to wait for the test because the test will be ready in 2 weeks or about 1 week. At that time the disease will be progressive and we can't wait for a week or 2 weeks. So that is why we can start a broad spectrum antibiotic immediately on presenting with the disease, uh, and later when the results are available, then we can change antibiotics uh, for for the smaller spectrum, the narrower spectrum antibiotic. But that is usually done when the treatment is long, like several months. When the treatment is about 1 or 2 weeks, then usually only one antibiotic is prescribed. It usually is broad spectrum antibiotic. Uh, the the broader the spectrum of antibiotic is, the more types of the microorganisms it will cover, and the the spectrum is very important, and uh, you should learn the spectrum by heart. The and There are some cases when the antibiotics will be prescribed for the prophylaxis, and but prophylaxis is not the uh, common way of prescribing antibiotics, because uh, most of the time antibiotics are prescribed only after the disease is already seen in the patient, but sometimes it can also be prescribed for the prophylaxis, and there are only four uh, cases for that. So the first is the treatment, the prevention of the streptococcal infection uh, for the patients with rheumatic heart disease. So the thing is that streptococcus streptococcal uh, infection is uh, from Streptococcus pneumonia, or Streptococcus pyogenes, or Streptococcus uh, uh, so another other types of the Streptococcus that will contaminate the heart, especially if there are heart valves installed. So the some patients will have a valve replacement with the artificial valve, and that can be easily contaminated with the streptococcus. So to prevent that, the and prophylactic antibiotic treatment can be done. So the second case is preparation for the tooth removal, and is done 1 hour before the surgery, and the and the wide spectrum antibiotics is used for this purpose. Third is the pre-treatment of tuberculosis or meningitis for those who will contact with the infected patients, that may be the hospital workers or the family members of the infected patients. And the fourth is the surgery on abdominal part. The abdomen surgery is especially important, but many surgical procedures will require prophylaxis and also the sterilization of the colon, for example, before the operation, uh, and also the prophylaxis for the abdominal operation, because they are bloody and which can lead to the infections afterwards. But these only 4 reasons are for the prophylaxis. Other drugs are usually can be used for the prophylaxis more frequently, but for antibiotics it's prohibited to use them for the prophylaxis unless one of these cases. The reason is that the antibiotic will become resistant, will acquire resistance. The resistance will be acquired for the antibiotic by the bacteria. So next time antibiotic will be not effective when you will prescribe and dispense it when the patient will require the treatment, when he will be actually ill. So that is why don't use antibiotic for prophylaxis, or don't use antibiotic unless you are sure you are ill. And the mechanism of action of the antibiotics is very important, and there are 4 mechanisms of actions. So for the the first is actually the inhibitors of the folic acid. So folic acid inhibitors will inhibit the synthesis of the tetrahydrofolic acid from the para-aminobenzoic acid. So PABA is very common, so para-aminobenzoic acid is used to synthesize tetrahydrofolic acid, and because the tetrahydrofolic acid is not permeable for the bacterial cell wall and cell membrane, and human cells will not synthesize the folic acid, because humans obtain the folic acid from the food, so it is a vitamin. So this is sulfonamides are the most common, and this actually not true antibiotics. They are synthetic drugs, but what their mechanism of their effect is as for the antibiotics. So that is why they also called antibiotics. So the second is the inhibitors of the cell wall synthesis, and this is the largest group and the most commonly used group as well. For the most of the mild infections and light infections, the cell wall inhibitors will be used. The selectivity of the mechanism of action is based on the presence of the cell wall uh, in the bacterial cells and the absence of the cell wall in the human cells. The plants also have the cell wall, so they will probably act on plants too, but usually cannot inject the drug to the plant. So the cell wall inhibitors include beta-lactams, and beta-lactams are the first antibiotics available, and then some so actually most antibiotics are beta-lactams. Cell wall inhibitors, mostly beta-lactams, and vancomycin and the other mycins are newly available antibiotics like phosphomycin and telavancin and daptomycin and vancomycin are also somewhat modern but still available for about 20-25 years, while beta-lactams are available like for more than 500, sorry, 550 years, 15 more, so actually for a long time. Then the next mechanism of action is the inhibition of the protein synthesis, and this also based on the difference in the size of the ribosomes, because the subunits of the bacterial ribosomes is different from the human ribosomes. That is why the inhibition is selective for the bacteria, and the protein synthesis inhibitors include tetracyclines, aminoglycosides, macrolides, and also some chloramphenicol is actually the most ancient drug, and then also clindamycin and linezolid are the new ones that are most expensive of all these drugs. But tetracyclines and aminoglycosides are most commonly used. Macrolides are less commonly, and the clindamycin is very effective but also most expensive of all them. And the fourth and the last, actually it is the last mechanism of action is the inhibition of the nucleic acid function or synthesis. So this includes only fluoro, uh, fluoroquinolones and also rifampin, but rifampin is not is used seldom. So most of the drugs are actually fluoroquinolones, and fluoroquinolones are most wide spectrum antibiotics, but also are very expensive. So that is why usually reserved for the resistant infections. So, and this is the fifth, actually, the inhibition of cell membrane function is very common with the cell wall synthesis, but these antibiotics are not used commonly because, like for example, isoniazid is only used for TB, for tuberculosis treatment. So, and polymyxin amphotericin B is also, so actually this group is almost the less commonly used one. So actually mechanism of action is based on the uh, like special cell type of the ball. So we will discuss that later when we return to the tuberculosis. So that is all with the antibiotics. Thank you for your attention, and what are your questions?
No, there are no question.
Sorry?
So this is all for today.
This is the lecture for antibiotics. What are your
Uh,
questions on that lecture?
No.
No questions? Okay, then I think we can conclude. So thank you for attending, and see you for the
Thank you.
next lecture. And please
thank you. Have a good day.
stay for the practice before. Please don't disconnect.
Okay.